it was in some other sessions. There was some last moment adjustments were made. I know it's running short of time. I'll just make it very brief. Okay. As you all know, Chromo vitrectomy is a very important topic. There is a very beautiful saying that the eyes see only the which the mind knows. So these are the headings. Before we start, it's very important to know some of the terminologies which are used in chromo vitrectomy. What is a dye? Dye is a chemical agent which binds to and induces the color. Vital dye is a substance which induces colors to the living tissues. Intravital staining is the staining of the living organisms, but the supravital staining is nothing but staining when the tissue is freshly removed from the body. So vitreoretinal interface, as we all know that the PVD has a very important role in management of the VMTs, macular hole, RD surgeries and diabetic retinopathies. So relief of these tractions is a very important part of any of the VIA surgery. So why do we need? Because most of the tissues which we deal across is optically clear. So we need to visualize it before we remove it. Basically the vitreous body, posterior highline, ILM and the ERMs. So what about ILM? It plays a very important role in management of the macular hole as well as the ERM. ILM acts as the basement membrane for the Muller cells. So any alteration in the cellular proliferation might cause the distortion of the ILM, leading to the formation of the ERM as well as the macular hole. So what about epiretinal membranes is basically a fibrocellular proliferation which is seen on the inner surface of the retina. Idiopathic ERMs are very much common. So if you see the pathology, basically consists of the RP and glial cells. So pathophysiology is nothing but the residual cortical cells which induces the proliferation of these ERMs. So chromo vitrectomy enables the staining of the intraocular vitreoretinal membranes and the tissue, thereby allowing their surgical removal. So it was Abraham et al. Was the first to perform the chromo vitrectomy. So what is an ideal dye? It selectively stain the ILM and the ERM, leaving behind the retina. So what are the other favorable characters? In nothing, it should be rapidly eliminated from the vitreous cavity. It should be photochemically stable. It should be soluble with the BSS. There should not be any toxic, and it should be adequate light profile should be there. So what about IVTA? Payman was the first to use the IVTA. Basically the trapped crystals between the vitreous gel and the suspension that gives a good contrast, so that it helps in inducing the PVD. So previously we used to use the preservative triamcinolone acetate. Now we are using the preservative free, so there is no much of ADAs reported. This is a short video about induction of, is not playing. Oh, sorry. So ICG is basically is a tricarbocyanate. It's a very bright anionic dye, which has a molecular weight of 775 daltons. So ICG has affinity to extracellular components of ILM, such as collagen and fibronectin. Even ICG we are not using now. Infracyanin green, nothing but a iodine-free version of the ICG. So what is the mechanism of toxicity? Basically the direct toxicity of the ICG is mainly related to pH or any iatrogenic surgical trauma or a light toxicity potential into ICG dye. So current recommendation is to reduce the concentration of the dye, avoid the repeated ICG injection into the bare area, injection of the dye far away from the macular hole. So it should be quickly aspirated from the vitreous cavity, and you should use a low concentration of the dye. So Brilliant Blue G is the one which is currently being used. It's a non-fluorescent blue dye, also known as acid blue 90 or commercial BBG. BBG has been used for a protein staining in a biological fields and bent non-specifically. It's ready to use. It comes in concentration of 0.15 and it has some neuroprotective effect also. The osmolality of the BBG was found to similar to that of the intraocular irrigation solutions. So advantage of BBG is like it's easily dissolved, osmolality and pH value are stable, and there is no additional techniques which are required before injecting BBG. So it stains similar to that of ICG, and the concentration used is very less compared to that of ICG. So word about negative staining and double staining. Negative staining nothing but first you stain the ILM, leaving behind the ERMs, and double staining nothing but we stain the vitreous and the ERM and we stain the ILM. So there is some problem with the videos, not able to show it, sorry. Yes. Okay. It's a very common surgery, so I just keep up the surgeries. So triform blue is just of a theoretical importance. It's not used in routine practice nowadays. So future concept, the quest for an ideal dye continues. An ideal dye should have an excellent contrast and a highly bioavailability. Many natural dyes have been investigated and are in pipeline. So with the introduction of acryplasmin, the pharmaceutical vitreolysis has come to the reality. So these are the final thoughts. So chromovitrectomy is an emerging field in ophthalmology. So important characteristics of the vital dye is ability to differentiate among the intraocular tissues, allowing the delineation and removal of target membranes. An ideal dye should address the intraocular tissues of relevance in via surgeries. Vital dye may greatly facilitate certain surgical steps in the anterior as well as in the posterior segment of the eye. So we should carefully evaluate the staining characteristics as well as the adverse drug effect related to the dye. Thank you.